I worked in emergency medicine off and on for 27 years. That was my favorite. I loved the emergency room. I do best under pressure, under stress. I can just really function really well. I wanted to see people get well, and I always thought, well, the emergency room is where people have the biggest needs, the most pressing needs, to get rid of their pain, to get over whatever it is that they came in for, to get rid of their fish hooks, whatever. And there's where you can really see some results, because I like to see results. I'm a person of action. The proof is in the pudding. You see the results, that's it. That's good stuff. Hang on to it.
My wife, Swanee, works with herbs, with the 8 natural laws of health, and she helps a lot of people. She goes around and she talks to a lot of people. She teaches them how to take care of themselves.
Why on earth would I choose natural healing when I have all of this knowledge and all of this availability of the convenience and the security of the co-workers in a medical facility? Is because you can put out the fire and sew up a wound, from a road burn or something in the emergency room, but there are so many people out there who are dying all the time from disease, and they're not helping them. I think that's probably why I like the emergency room, is because you could really see some results. In med-surg nursing, which I've done a lot of, in geriatrics I've done a lot of, on the cardiac unit I've done some of that, pediatrics, ICU, all of that I've done some. You don't get results. And I've watched those people lay there with all the tubes in them and the misery that they go through. There's nothing more miserable than having 10 tubes and being on a respirator. Boris is a man that I had met not very long before he had a heart attack. And his wife and I had been very much conversing about health and health principles, because I had just discovered Dr. Schultz and Sam Beiser's videos, and I was sharing with her, and she was all excited about that.
I am very thankful that somebody put time and effort to study how those natural tinctures work and how it cooperates with the body to help people. That's alternative. That is the answer.
And she was telling me some of his troubles, and I knew that he'd had a previous heart attack. And so I was telling them about hawthorn and cayenne.
Where I live, I'm out in the outskirts of town, and so it's take me to get to the hospital about almost half hour. So, in a half-hour time, you can be dead.
Then one morning early, about 8 o'clock in the morning, I get a call from her, and she says, my husband is telling me that he's not had a very good night, and that he's right now got a lot of pain in his chest and his left arm, and his face is white, and she was really concerned. What do I do? And so I was telling her, give him some hawthorn, give him some cayenne right away, and keep it going.
When you have perspiration and you have pain, it is a matter of 2 minutes. When you're taking the hawthornberry and cayenne, it works, and pain is gone. I even doesn't talk anymore to my wife about it. When I have problem and that I have pain, I go and take the cayenne, and I take the hawthornberry, and it's gone. And so it's no big deal.
And then it took him. I gave him some follow-up instructions, and that was, of course, hawthorn cayenne, and the diet changes. Actually, he had a fairly good diet, but there were a few things that he could do differently.
It is working. I'm a living testimony. It's working.
I got called to Vancouver, Washington, because we wanted to help this Linda's father get well. He had cancer.
I needed help, so I called Swanee, and she came right away.
And so he wasn't keeping things down on his stomach very well, and when he would throw up, I could see flecks of blood, and I thought, boy, he's really irritated in there. He'd had a bunch of chemotherapy, and they had centered on some of his digestive tract. And he just did not like to take cayenne, and I was trying to get the cayenne down him.
Doctors had given up on him. They told him that his cancer was clear through his body, but they couldn't pinpoint where.
Immediately, his lungs began to fill up. He was starting into a real severe respiratory buildup of fluid that you could hear his breathing audibly, and it took about 5 minutes, and it really built up bad, so bad he raised up in the tub and says, "I can't lay down." And I said, "You know, we can really give you some help with your breathing if you'll just take some more herb tea." In about 5 minutes, he said, "Oh, all right, give it to me." So I jumped up, and I ran, and I got the lobelia, and I poured out more than a teaspoonful. A teaspoon's usually 4 droppers full. It had to be 5 or 6 droppers full. And I put in a little bit of water, and he drank it, and he kept it down. And I laid there, and I go, well, I wonder what's going to happen. And I was laying on the floor, and he was in his recliner, and I was listening to him. And I saw his eyelids start to close, and his breathing was getting better. And I said, praise God, you know, this is really working.
At first there, he couldn't even get up and walk to the bathroom by himself without help.
And sure enough, within 10 minutes, you could not hear any more of his breathing at all. And within 20 minutes, he was sound asleep. And I went to sleep because I was exhausted. I listened to his lungs with a stethoscope the next morning. There was not a bit of moisture on his lungs whatsoever at all. This was Sunday morning. This was 48 hours later after I had gotten there. He was feeling a little better than he had the evening before. And he had gone to lay down and rest. While he was in there with his wife on the bed, I hear her say to me, "Swanee, I think you need to come in here." Just about that tone of voice. And so I go, okay. And I just laid my stuff down and walked into the room. And I walked into the room, and here was a pan like you get at the hospital, you know, everything's in it, that little dishpan-like pan. And it had at least 2 to 3 inches of bright red blood in it, where he had vomited this much blood.
I didn't think Dad was going to make it.
This is a life-threatening emergency. He will bleed out in less than 10 minutes if we can't get this stopped. There's no time to call 911. This man's a dead man. And in all my 27 years of working in the hospital, and especially emergency rooms, med-surg floor, where you see these kinds of things happen, I've never seen anything short of surgery stop the bleed or else death. And I was running for the cayenne bottle because Schultz says cayenne stops bleeding. I had never used it before in my life for stopping bleeding. And I'd used it for ulcers and other things like that because I'd healed myself. So we drop 1 dropper full of cayenne tincture down this man's throat, because at the same time I was thinking what I just told you, I was also telling him, you have 2 choices. We can either take some of this herb and stop your bleeding. That was faith, let me tell you. Or we can call 911, and if you make it, they will do surgery to try to stop this bleeding. And at the same time I was thinking, they're not going to do surgery on this man. He's a terminal cancer case. They're going to let him bleed out. I know. I've been there. I know what they do. So I'm going for the cayenne bottle, and while I'm talking, I am getting it unscrewed, the lid screwed off, and ready to drop in his mouth. And at the time he opened his mouth, and I said, here we go, it's going to be hot. I dropped it down, and he stared daggers at me because he hated hot stuff. Well, I just stood back and watched for a minute, and within 3 to 4 minutes he threw up again. And this time there was 2 baseball-sized clots floating in about 3 cups of reddish liquid.
She kept giving him things that made him throw up, and the stuff he spit up. It was awful.
And I said, great. I said, we've pretty much done the job. I said, you've done so good. And I said, now we need to mop up and finish the job. We need to make sure that this is going to stop completely. And so I said, we need a little bit more of this. How would you like to take it? Straight like you just did, or in a little bit of water? And of course, you picked the water. So I put 2 droppers full this time. I wanted to give it a complete finish. And he drank that down. And it was about 7 minutes this time before he threw up again. And when he threw up again, it wasn't even a full cup full of tiny little clots, little flecks of clots in that cup full of liquid. And I said, we don't need to do anything more. I said, your GI bleed has stopped.
Swanee knew what to do. And it worked. He pulled through.
little later, she and her husband told me about her heart problem and how she was on some heart medications.
They took her to the hospital then and gave her medication to take the fluid off of her lungs and said there's nothing more they can do for her there. The blockage was 90% in 3 arteries and 30% in one, and it's diffuse blockage where there was blocked all the way down the artery and there's no place to bypass to. So they gave her some medication and sent her home and hoped for the best.
But of course, with 3 vessels plugged, right away the medical mindset is this patient's going to die. We can't do anything for him. The TMR was very experimental. They didn't know how long term it was. They figured maybe 6 months. Well, she'd gone 2 years. Well, in their mind, they go ahead and put her on all these medications because they know she's going to die. They don't think she's got past 6 months to live. And what people don't know is how doctors think. And doctors don't know natural healing. They don't realize that you can reverse this and get well. And so they put you on these lethal medications, essentially, thinking that it's going to buy you time and quality while you have time left, because they don't know natural healing. And so then the next thing I know is she's calling me with, I've got this pain in my chest, and I can't breathe, and I've got this heaviness on my chest. And this was a call, again, 1:30 in the morning, woke me up, and wanted to know what to do. They didn't want to go into the hospital. They didn't want to do any more drugs. And so we went through the whole scenario of relief, and I sat there for probably an hour and a half, walked them through this over the phone of putting the cayenne on the chest, as well as taking it, as well as taking the hawthorn, and eventually she got tremendous relief from that.
10 minutes she was coming out of it, and we gave her a dosage about 10 minutes apart for 3 times, and then at that time the moisture in the lungs and everything, because of so much cayenne, she had to vomit, and it brought, we'd only given her maybe 4 ounces of fluid along with this, but we brought up 1.5 quarts of fluid, and she could breathe within half an hour after that.
And she would get rid of lots of fluid, and it would give her relief.
She'd taken some nitroglycerin while we were in the pickup. Take 1 dose, and then 5 minutes later take another dose, and 5 minutes later take another dose. But it wasn't doing what it was supposed to be doing.
What I didn't realize was that they weren't following other instructions about, you've got to go get off your medications. And she was still taking her medications.
I just went in and gave her a teaspoon of cayenne, a teaspoon of hawthorn, and
I knew it too.
And within 10 minutes, she was coming out of it.
But because she was still on the heart medications that was causing the congestive heart failure, which was, she was on at least 3 of them, at the major side effect, the one that in the books is the foremost one, it's in black, it's capitalized in bold, congestive heart failure, body fluid buildup. And as long as she was on those, she wasn't going to get well.
I was at the point where I was afraid to leave her home alone even with the nitroglycerin, because it'd start acting up, and sometimes it wouldn't go away right away. But with the cayenne, she can take that and it disappears, and I know from being around her and having her take it that she feels so much better and acts so much better after she takes it, that it gives you a sense of security, even if I'm not the one that's taking it, to know that it's available for her to take.
Well, my title and what I'm responsible for right now, I'm a director of nurses. I've been in nursing one way or another for 30 years. And my whole system crashed. And my diabetes went totally out of control to the point where I almost died from the side effects of it. Without herbs, I think I would have. And that involved the heart.
He'd clean out a little bit more, and then he'd go back to doing some of his old lifestyle that he enjoyed so much. And his blood sugars would then climb again, and he'd feel bad. And I could always tell by the way his breath smelled, because it smells like acid or ketones.
Now, the medications that I was taking before I was using herbs, the side effects of that is increased insulin tears up your cells in your body.
A few days, not too long ago, I said, have you taken your blood sugar lately? And he goes, no. And I said, you need to. His breath smelled so bad, it woke me up with a start, and I jumped up out of bed because it was so foul.
I'm a stubborn person, and my wife got me to use herbs by letting me try the medical approach, and when I did that, it didn't work. And finally, when I was to the point where it was just about the end of things, my wife, who helps a lot of people with herbs, got me to do it, and it worked.
My husband is a very strong personality, which is good if he'll use it for the good, and he is, thank God. But to begin with, it was a very big struggle. When I first married him, his triglycerides were 900, his cholesterol was over 500, and his blood sugar was way out of control, and it had just been diagnosed. And this is a man who loves what he loves, and if he's going to do something, he's going to do it 100%. That's why it's been a 2-year struggle with making the transition from the medical mindset to natural healing and accepting it wholeheartedly.
I was very skeptical. And I was also, because of my long experience, I was skeptical of herbs because of my medical background and what I had seen done or not done. I felt that I needed to do the medicine side of it rather than the herbs.
I knew hardly anything of the details of the day that he was having his chest pain and his symptoms. I was busy. I'm always busy. And I've tried to educate him to be responsible for himself. And if he has a problem, to take charge. Because everybody needs to do that for themselves. You can't use someone else to do it for you. And I knew that he wasn't feeling good. He hadn't been because he had lost a whole lot of weight because the docs had been giving him some medication, and he was hanging on to natural healing with one hand and the docs with the other hand, and it was not working, let me tell you.
I sat in front of our wood stove one day, and I absolutely knew that if I got up, if I moved, or anything else, I'd take about 2 steps, and I knew I would be dead. I would die right there.
So I knew he wasn't feeling good, but he wasn't saying much to me. He never complains. He seldom ever complains. If he complains, I listen. He was just laying there in his chair.
I've taught CPR. I'm a CPR instructor, and with that knowledge, I know that most people do not seek help. I didn't either. I didn't do it. I waited about an hour, maybe 2 hours, and just knowing that I was going to die any minute. I was having a heart attack. I had all the classical symptoms of it. I had the pain. I had the cold sweat. I had the feeling like the wood stove I was sitting in front of was sitting on my chest. And I finally told my wife what was going on.
And I got to thinking, I thought, honey, are you taking Hawthorne? And he goes, no. And I said, well, if your heart hurts, you need to take Hawthorne just to protect it, if nothing else. And it should take, any pain away that you have. And I said, and how about some cayenne? Cayenne would really help to get rid of the pain.
And she went and brought me, I think it was about an ounce of Hawthorne, and gave it to me, tincture. I took that, and my heart started feeling better, immediately. And in an hour, it was feeling better, but it wasn't right. And then she brought me cayenne, and that did the trick. That straightened me up.
Later, he told me, maybe 3-4 hours after we first started with the cayenne and the Hawthorne, it was like he was a totally different person. He could breathe now. He was more relaxed, and he got up and did a few things and laid back. He's pretty tough, you don't put him down easy. He says, he says, I think I had a heart attack. And I'm still going, yeah, sure. He said, but the cayenne and the Hawthorne took all the pain away.
It was a little while later, a couple of weeks, that my wife told me about taking cayenne every day, taking 3 spoonfuls of cayenne a day to help my heart. Well, she meant teaspoons. I didn't realize that. I got these great big spoons like you use to dip out a salad. I took 3 of those, and I put them in tomato juice, and I drank it. And I like hot stuff, so it didn't bother me going down. And I took this stuff. Didn't kill me or anything like that, but I thought I really didn't want to bring that back up. And so I kept it down. That felt like, if you've ever had anything like a car that all of a sudden the carburetor started working and it just picked up speed and started going, I felt my heart right then. It was like somebody kicked it in gear, and it just started working the way it was supposed to. My blood pressure came down, everything was going good, and it's still going good. When I've talked with people who are skeptical about using herbs, and they know me, and if they ask me does this really work, what I respond to them is, first off, I'm alive. And they look at me, and then I get to tell my story. I get to tell them about sitting there knowing I was going to die. And I knew, beyond a shadow of a doubt, I was going to die. There was nothing anybody could do. We lived too far away from any medical help, out in the mountains where we live. Without the herbs, I am very convinced that I would be dead right now.
We have a dear little friend who has just promoted this so well, and she's in her 70s, I believe. She may tell you that she's pushing 80. She had developed seizure activity, from a lot of baggage that she carried from the death of her husband. All that I know that the doctor has had to say about her seizures before or after is that she's still got them and she's going to have them for the rest of her life, and that she's got to continue to take these medications. Well, she wanted off the phenobarb so bad because it made her really drowsy and sleepy. So he tried her on Dilantin, and she had some horrendous side effects from that. And she even tried to call me while I was down in California because she really wants off the medication really bad. And she began to act funny. And this all happened in about 5 seconds' time. I was noticing that she was acting funny, and I said, Alice, why don't you go ahead and sit down, hon? And at that time, I ran to the door to get the lobelia because I knew she was going to have a seizure on me. It just was something you learn from experience. And sure enough, by the time I got to her, within those few seconds' time, she was in a full, tight, grand mal seizure. And I had watched the way a seizure will come in different patterns of the body tightening up, and then pretty soon after the pattern has been followed, your whole body is rigid and tightening up. And she was biting her lip. In fact, if you look at her today, her lip is uneven from where she bit her lip, and she bit it almost completely in two or three different places. So I had the lobelia out of the bottle, and I just pulled her lip aside and stuck the lobelia, 1 dropper full of lobelia, in there. She was into the seizure by this time probably a good 10 to 15 seconds. Full, tight, grand mal seizure. And what I saw blew me away. That 1 dropper full of lobelia, within about 3 seconds' time, it was just like it melted her whole body all at one time, relaxed it. And I could see the whole seizure just stop right there in midstream. Now, most seizures will last, they vary anywhere from 20 seconds or maybe even 10 seconds. But she was still going strong. And her seizures, from her track record, were anywhere from 45 seconds to 1.5 minutes to 2 minutes. Okay, within 3 seconds' time of this lobelia, her whole body relaxed totally.
Well, no, nobody had any idea what would happen.
And I thought, well, post-ictal stage, they sleep it off. Well, let's bring her out of that and bring her back to reality. So I started with the cayenne. And I gave her 1 dropper full of cayenne, and almost immediately she came up out of that post-ictal stage, but not to full consciousness.
It's a real comfort to know I've got the backup of the tinctures.
And I can't tell you how many times people have come to me and said, I paid, over $1,000, and I got a few medications, I had a few minutes with the doctor, and they didn't work.
The cost as far as the herbal preparations, you can order, as my wife reminded me, you can order lobelia, $8 for a pound.
I think that side effects of medications are a bigger problem than the original problem itself.
For me, the side effects of cayenne and hawthorn berry are life.
The proof is in the pudding. What you see is what's real. I've had so many doctors tell me, well, it's not backed up by scientific research, so I am really a little hesitant about, believing this. And I said, well, when you see a full-blown GI bleed stop right in front of your eyes by using cayenne pepper, does that make you a believer?